Hello, I'm Tóla Collier, and this year for Heritage Week I'm working with Athlone Castle to tell you a bit about medieval medicine and the world of the barber surgeon. As you can see, I'm dressed in the robes of a barber surgeon from around about the high Middle Ages, and at that time medicine was based on a concept called the Four Humours, and that said that everybody contained four basic fluids in the body. They were blood, phlegm, yellow and black bile, and the balance of those within the body was what made a person healthy or unhealthy. Doctors and barber surgeons said or thought that they could rebalance the humours and make people healthy again when they became ill. One of the best ways to do this was through bloodletting. Now, how would a doctor diagnose somebody as needing bloodletting? Well, just like today, you'd go to your doctor and you'd give them a urine sample. And that's exactly what I have here in front of me. This is a urine sample that I got from a patient. First of all, the doctor would look at it, he'd examine it for its sediment, then he would sniff it to see if there were any various chemicals or acidity inside it, and then of course, following on from the principles of Galen, he'd taste it. Now, I'd say that based on that sample there, you're normally a sanguine type of person, but you're feeling a little bit caloric at the moment, which means you have an imbalance of yellow bile. So what we'll do is, after we cut your hair, we will then do a little bit of bloodletting. So this is how bloodletting was performed. Using the same bowl that you would have been shaved with, the barber surgeon would put it onto the customer's arm, and then using either a scalpel or a device called a phleem, he would just pop open a vein and then putting a stick into the person's arm, just like that, squeezing it, and out would come between 3/4 of a pint and 1.5 pints of blood. And that would make you feel much better. So with that done, that would be full of blood. Put that down, and then that'll be tied off, probably using a bandage, somewhat like that. Now, various other jobs that the barber surgeon would have done, the barber surgeon would also have extracted teeth. So you'd go to the barber surgeon if you were having problems, he would use this to yank out the teeth if you had holes in it, or alternately, he would use this device here. This is a catheter, and it could have been used in two ways. It could be used for dental work. It could also be used if you had a urinary tract infection. Other things that would have been done, they would also have performed surgery called needling on the eye. So you'd sit in front of the doctor, the barber surgeon would then hold your eye open, and then using a needle, they pull down anything that was in the eye, hopefully restoring your sight. If you were very unfortunate and you were suffering from a major wound, you might have to have an arm or a leg amputated, and this is an amputation knife. It's sharp on the back and on the front. So making a cut from behind, bringing it up, over, and then cutting through. And with that, peeling down the tissue, and then finally using the amputation saw to saw through the bone and remove the arm. So if you enjoyed that video and you'd like to learn a bit more about the medieval barber surgeon or about medieval medicine, you're going to have to come and see me in Athlone Castle, or at one of the many other historical sites around Ireland that I go to throughout the year. I'm Tóla from Laoch Living History. Thank you very much for your time, and I look forward to seeing you very soon. Thank you.